Hello guys, welcome back to my channel. Welcome back to Real Homeopathy. Please like, share, subscribe to my channel. And the channel name is Real Homeopathy. Today I'll be continuing again with the puberty, which is normal and abnormal homeopathy. I have left out with puberty menorrhagia here. Today I'll be explaining you about the puberty menorrhagia. What is the meaning of menorrhagia here once you attain a puberty? So the menstrual abnormality, okay, the menstrual abnormality in adults, which is common here, so that is called as puberty menorrhagia. So the periods which are there, it might be heavy and sometimes it might be irregular, or sometimes it is very less, which is to say scanty initially. So there is something abnormality in the menses which happens in adults, which adult girls, so it is caused to be like puberty menorrhagia. Periods are heavy, irregular, or scant, which is to be say very less. Okay, the important causes of menorrhagia are, which is the etiology. So there are 5 main causes. First one is dysfunctional uterine bleeding. So dysfunctional uterine bleeding, which is seen more commonly for 95%, which is like anovulatory cycles, which leads to unopposed estrogen increase in levels. Okay, and we will see hyper endometrial hyperplasia. So this dysfunctional uterine bleeding leads to unopposed estrogen, which is endometrial hyperplasia, increase in that, and again coming to prolonged and heavy periods. So prolonged and heavy periods is the last of this dysfunctional uterine bleeding. So next, coming to the second main cause is endocrine dysfunction. So this endocrine dysfunction, again you see there are 2 types, which is a polycystic ovary syndrome, which is PCOS. Again, in the next classes I'll be explaining about what is PCOS in detail. Stay tuned for that. And next, coming the second cause is hypothyroidism or hyperthyroidism. So this is where the bleeding is very much. Menorrhagia, where there is abnormality in the bleeding. So first one is dysfunctional uterine bleeding, the second main cause is endocrine dysfunction, and the third one is hematological causes, which is idiopathic cause, idiopathic thrombocytopenic purpura, idiopathic thrombocytopenic purpura. Furthermore, I'll be explaining you in detail about the idiopathic thrombocytic purpura. Next, coming to von Willebrand syndrome. So von Willebrand syndrome, again the next one will be leukemia, the next hematological cause. If there is any leukemia, if there is any von Willebrand disease, or any idiopathic thrombocytopenic purpura, I'll be explaining all these symptoms in the next class. Next, the fourth main cause is the pelvic tumors. If there are any pelvic lesions, then there will be heavy bleeding, which is a fibroid uterus. And second one you will see sarcoma botryoids. Estrogen, third one is estrogen producing ovarian tumor. So all these things, all these PCOS, idiopathic thrombocytopenic purpura, all these questions I'll be again explaining everything in detail in the further classes. So these are the main causes of menorrhagia. Okay, next, coming to the pelvic tumors over. Finally, there is a pregnancy complications, which is abortion. Then only you can see there is a bleeding. So these are the 5 main causes. Okay, then how to diagnose this? So how to diagnose this is a menorrhagia once there is a bleeding? How to do that? So it is made by a careful history taking and through clinical examination. Person has to completely have a careful history taking, and there should be certain clinical examinations. Next, we'll go to investigations. So in investigations, you have to do hematological examination. In hematological examination, you will see, which includes, there is bleeding time, which is BT, CT, bleeding clot time and clotting time, and platelet count also you have to check for, and thyroid profile which includes TSH, which is a thyroid stimulating hormone, T3 and T4, triado and tetrado, T3 and T4. Next, coming to coagulation parameters, where you will see PT, PTT, factor 8 and von Willebrand factor. So all these you will see here in coagulation parameters, and certain imaging studies of the pelvis by ultrasonography, which is abdominal USG and MRI, CT scan, and some of the above mentioned hematological investigations. Through these you will understand the thing here. So this was it for the puberty menorrhagia. So this was the main causes which you have to mention. So preferably they will be asking this question for 5 marks. Most probably the causes will be asked for 3 marks. That's it. Next, again we will go to a new and important question, which is a menopause. So here in 2012 this question was asked for 3 marks. Okay, menopause was asked for in 2012, it was asked for 2 marks, and 10 marks was asked in 2010. So it is very essential for 10 as well as 3 marks, and sometimes they will be even asking for 5 marks. Okay, the definition of this menopause here, it means, must know question, you have to read that. So menopause means permanent cessation of menses, okay, at the end of reproductive life due to loss of ovarian follicular activity. Okay, it is the point of time when last and final menstruation occurs. So this is a time when last and final menses occurs. So this is a cessation, okay, of menses. So the clinical diagnosis you can do is through amenorrhea, which is stoppage of menses. Okay, the age of menopause. Let's see the age of menopause here. Next, coming to age of menopause. Okay, the age at which menopause occur is genetically predetermined. The age of menopause is not related to age of menarche or age at last pregnancy. It is also not related to number of pregnancy, lactations, or use of any oral pills, or socio-economic condition, race, height, or weight. So thinner women have early menopause. So thin people have usually early menopause. However, cigarette smoking and severe malnutrition may cause the early menopause. So there is any cause, like again 45 to 55 years of age, there will be, that is the age where it ranges of these menopausal this thing, and average ranges way from 50 years and average ranges to 50 years. So this is the age of menopause. Next, coming to the clinical importance. Clinical importance, it is due to increased life expectancy, especially in affluent society. About 1/3 of lifespan will be spent during the period of estrogen deficiency state. Okay, with long-term symptomatic and metabolic complications. So this is the main metabolic complications. Okay, it is the estrogen deficiency stage. 1/3 of lifespan will be spent during the period of estrogen deficiency state. And next we will see is menopausal symptoms. In 10 marks, whenever they ask for 10 marks, you have to write the menopausal symptoms. So how you identify if there is a menopausal symptoms. So the important symptoms and the health concerns of menopause. First one is vasomotor symptoms. Second one is urogenital atrophy. Third one is osteoporosis and fracture. Fourth one is cardiovascular disease. And fifth one is cerebrovascular disease, which is related to CNS. So there are certain changes that all happens in the above mentioned. And next coming to, there is psychological changes that happens once a lady stops menstruating permanently. And next there are certain changes that happens in skin and hair and sexual dysfunction, dementia and cognitive decline. Dementia and cognitive decline. So next coming to the symptoms here. Symptoms of menopausal transition. First one, there are certain menopausal changes that happens. There are 6 changes. So first one, there is a menstrual change. There will be a shorter menstruation, shorter cycles, okay, which is a more common, and there will be irregular bleeding here. Shorter cycles, irregular bleeding. And next coming to the vasomotor symptoms, which are hot flashes, night sweats and sleep disturbances here. Next coming to psychological cause. Psychologically, we see there will be irritability of a lady. Next coming to mood swings, and she will gradually have a poor memory. And finally, we will see in psychologically there will be a depression. Next, fourth one, we will see there is a sexual dysfunction, which is a vaginal dryness. And next one is a painful menses, which is dyspareunia. Which is a painful menses. Next one we will see is urinary symptoms, which is incontinence of urine. Incontinence. Next one, urgency to urinate. And next is dysuria, which is a painful urination. Others you see like backaches. Others such like backaches and joint aches. So there are certain risk factors which happens from menopausal to cardiovascular disease, such as there is a hypertension and family hyperlipidemia and smoking habit, impaired glucose tolerance, which happens due to menopause. There are certain disturbances or certain changes that even takes place in the cardiovascular disease. Next coming to diagnosis of menopause, you will see cessation of menses for consecutive 12 months during, and next average age of menopause is 50 years. Appearance of menopausal symptoms, hot flashes and night sweats. Next we will see vaginal cytology, which showing maturation index of at least 10/85/85 features of low estrogen. Okay, next one is serum estradiol, which is less than 20. Next one is serum follicular stimulating hormone and luteinizing hormone, which is less than 40. Okay, kindly do like, share and subscribe to my channel. I want you to stay tuned for more of the further updates. Okay, bye bye.